Hi, I'm Miriam Olienses-Torres, licensed clinical social worker and care manager. For the last 30 years, I've had the opportunity to work with families who have concerns about aging loved ones and struggle to find the information they need to be the best advocate they can for their loved one. Our demographics are changing. People are living longer. What that also means is that people are living longer with multiple health conditions. What that means for us as family members who care for them is that we need to be aware of what's going on in our parents' health care system so that when the need arises, we are in the best position possible to be their advocate in what is a very confusing and complex healthcare system. So what do you need to know in order to be a good healthcare advocate? Number one, to know your parents' health, to be aware of their diagnoses, their conditions, their medications, their medical providers, and the common use of online medical records has been a wonderful tool in helping us to fill that role. Number two, to understand what their attitudes are towards their own health care. What kinds of treatments do they want and don't want? If something arose that needed treatment, would they want surgery or not? How would you work with them and their healthcare providers to make the decisions that are going to be right for them? Number three, have your parents done their healthcare power of attorney documents? Have they worked with you or others to create a document that specifies what their healthcare wishes are and who are the people who should be speaking for them if they're not able to speak for themselves? The next, think about getting a release of information that they would sign that would enable you to have access to their information. The healthcare power of attorney is a wonderful document to have, but the authority is only transferred to the healthcare agent when the person is unable to make their healthcare decisions. There are many times in which we need to be able to help our loved ones in an urgent care situation, in an emergency room, in a hospital. They may not be incapacitated, but they do need somebody who has the authority to speak with their providers and communicate with them and help them to understand what's going on with their health care. The key to being a good healthcare advocate is to have the information you need to operate in the best interest of your parent. So I encourage you to begin these conversations, get the information you need so that you can be there for your parent in the way that you want to.
Support for Next Avenue Moments is provided by the Helen Daniels Bader Fund, a Bader philanthropy.